Introduction: Postpartum core strength.
Rebuilding core strength after pregnancy is important for stability, posture, and overall comfort. Many new moms experience weakened abdominal muscles and separation of the core, known as diastasis recti. Choosing the right exercises can help restore function, support daily activities, and promote healing. Always consult a healthcare provider before starting a postpartum exercise routine.
The importance of gentle core activation.
Gentle core activation is the foundation of postpartum recovery. Beginning with simple exercises allows the abdominal muscles to re-engage safely. Focus on breathing and connecting with your core before progressing to more challenging movements. This helps prevent injury and supports long-term healing. Consistency and patience are essential during this stage.
Pelvic tilts and deep breathing.
A pelvic tilts combined with deep diaphragmatic breathing are safe for most new moms. Lie on your back with knees bent, feet flat. Gently tilt your pelvis to flatten your lower back against the floor as you exhale. Then release. Pair this motion with slow, deep breaths. These moves help reactivate the core and support pelvic floor health.
Heel slides and bent knee fallout.
Slides and bent knee fallout exercises help engage abdominal muscles without straining them. For heel slides, lie on your back and slowly slide one heel along the floor, then return. Bent knee fallout involves dropping one knee to the side while keeping hips stable. Focus on movement control and maintain gentle abdominal engagement throughout.
Modified side planks and bird dog.
This is the most common functional movement. Today, talk about the following and listen to the details. Now, it's time to stretch the core.
Precautions and progression tips.
Always listen to your body and watch for symptoms like pain or bulging along your abdomen. Avoid classic sit-ups or crunches early on, as they can worsen diastasis recti. Gradually increase intensity under professional guidance. Staying consistent and patient will lead to safer, more lasting results in your postpartum journey.